New questions emerging over Health and Human Services Secretary Robert F. Kennedy Jr.'s leadership. The New York Times talked with dozens of people who've had direct contact with Secretary Kennedy and other health department employees. The Times reports Kennedy has prioritized food policy, pesticides, and vaccine issues, while key public health posts remain vacant across the federal government. Joining us now is Dr. Deborah Howry, former chief medical officer at the CDC. She resigned last August and has previously testified before the Senate about CDC chaos under Kennedy's leadership. Dr. Howry, thanks so much for being here. This New York Times report paints a picture of a health secretary who's far more focused on food recommendations, pesticide exposures, and hunting for evidence to support for his long-held beliefs that vaccines are harmful. He's made just one known visit to the CDC since last August after a gunman opened fire on the headquarters and killed a police officer. Given your experience in past administrations, what would you typically expect from an HHS secretary?
This is highly unusual. This is the only HHS secretary that I did not brief in the decade I was at CDC. And, during an Ebola outbreak or the hantavirus outbreak, you would expect that career scientists would be briefing the secretary on these issues. And certainly with an interest in chronic disease, you think he'd want to hear from the chronic disease center director. Instead, he moved her out of the agency. So these are just really troubling things for somebody who wants to make America healthy again, that he's not listening to his health experts.
The New York Times also examines what some public health experts are calling a leadership vacuum. No confirmed surgeon general. Roughly half of the NIH's institutes and centers have acting directors. The acting head of the National Institute for Allergy and Infectious Diseases was recently fired. The FDA's top drug regulator was pushed out. The list goes on. What's the real-world impact of having so many critical public health positions either vacant or temporarily filled?
You don't have people that are really empowered to make those decisions, and you lose a lot of the institutional memory. At CDC, 80% of the senior leaders are gone. And if you look at both hantavirus and Ebola, the division director that was above that, the center director, and myself all have not been replaced. There's actings in several of those roles, and my role is still currently vacant.
An HHS spokesperson told The Times they are aggressively recruiting top talent to fill every remaining vacancy, adding nothing has slowed our ability to execute. Is that how you see it? And what are you hearing from your former colleagues in government?
It's not how I see it. When you look at the number of vacancies, about 30% of the CDC workforce is gone. I'm not seeing an aggressive attempt to bring it back. And we really need science there. When you look at how Dr. Bhattacharya is really not following science when it comes to things like Ebola and hantavirus travel restrictions. You want to make sure he's got the experts around him to be driving that information. And when you have leadership gaps across the agency, great scientists that are being really held hostage by political appointees, not able to speak to the public as much as we would like, it doesn't make any of us safer.
Dr. Bhattacharya is a health economist who's been put in charge of the response to this Ebola outbreak. Dr. Deborah Howry, thank you as always for offering your expertise and insights.